Welcome to another lecture by Medico Medics, Bacterial Vaginosis. In this lecture, we will begin with a general introduction of bacterial vaginosis. We will talk about normal physiology, discuss pathophysiology, compare normal versus pathological, mention a case example, then look at symptoms, diagnosis, treatment, and end with a summary. Now, bacterial vaginosis, abbreviated BV, is a common vaginal condition resulting from an imbalance in the natural bacteria of the vagina, where good bacteria, quote unquote, decreases and bad bacteria overgrows, leading to symptoms like discharge and odor. So it's caused due to the imbalance in the vaginal flora. So normally, lactobacilli, which is the good bacteria, dominates the vaginal flora and creates an acidic environment. In bacterial vaginosis, however, lactobacilli, meaning the good bacteria, decreases, and anaerobic bacteria like Gardnerella vaginalis increases. The incubation for BV is approximately 4 days. So it sounds a bit counterintuitive, but think of it like this. In a healthy vagina, good bacteria keep the environment acidic. This prevents infection from happening. But in BV, the good bacteria are outnumbered by these bad bacteria instead, leading to an imbalance. So this is a typical example of a little bad is good. Too much bad is bad. So in essence, it is normal to have a degree of bacteria because it keeps the environment acidic enough to push away, let's say, or keep worse bacteria from entering that space. If for whatever reason this quote unquote good bacteria is decreased, then it will give rise for these opportunistic bacteria to increase instead. Now, what are some risk factors for BV? First of all, BV is not classified as an STI, meaning a sexually transmitted infection, but it is more common in sexually active women. So for that reason, sexual activity is still considered a risk factor. And then we have douching or douching, however you pronounce that. It disrupts the natural balance of vaginal bacteria, which also increases BV risk. And this is essentially a procedure whereby the vagina is washed with some cleansing solution or with water. Another risk factor is new or multiple sexual partners. And these factors are associated with a higher risk of developing BV. Symptoms include discharge, so a thin, grayish-white discharge with a strong fishy odor, especially after intercourse. Another symptom is itching and or irritation. So some women may experience mild itching or irritation. Now let's go back a little bit and talk about the normal physiology of the vaginal microbiome. So we have lactobacilli. Lactobacilli bacteria produces lactic acid and hydrogen peroxide. These two keep the vaginal pH low, meaning it keeps the environment acidic, around 3.5 to 4.5. Now, this acidic environment is what prevents the overgrowth of more harmful bacteria. Therefore, lactobacilli are known as the quote unquote good bacteria, precisely because of its somewhat counterintuitive consequence of keeping the environment acidic. Most of us would probably think that a acidic environment is equal to something bad. But here you can keep in mind that, for example, in our stomach, we have a very acidic environment. It helps break down microorganisms, etc., that follow when we eat food. The acidic environment in our intestines or in our stomach helps break down and helps in digestion. So acidic isn't equal to bad. And this is another prime example of that. So what kind of defense mechanisms are in place here? Well, we have mucus production. So mucus in the vagina helps trap and flush out pathogens, supporting a healthy balance. Vaginal mucus acts like a barrier, catching harmful bacteria and helping keep the area clean. Another defense mechanism is our immune cells. So there are immune cells in the vaginal lining that help detect and fight off pathogens that could cause infection. Then moving on to the actual pathophysiology of BV. So there is a disruption of the vaginal flora. When the lactobacilli that we just explained is part of the normal physiology, when that decreases, it reduces the production of lactic acid. And then when we have a reduction of lactic acid, we will then have a less acidic environment, meaning instead of lesser pH, we will have an increase in pH. So the vaginal pH will rise, and this will allow anaerobic bacteria like Gardnerella vaginalis or Prevotella, for example, to overgrow. And these anaerobic bacteria thrive in this lesser acidic environment. And these produce the chemicals like amines that cause the characteristic fishy odor associated with BV. Now, the body's immune response may be mild because these bacteria are part of the normal flora, just in lower amounts. So symptoms like discharge and odor result from the bacterial imbalance rather than from an inflammatory response. So these bacteria that are present around, however, kept at lower levels. Why? Because we have an acidic environment that doesn't allow them to overgrow. And this barrier here, let's say, the cause of the acidic environment at a stable point is made by the lactobacilli. But for whatever reason, lactobacilli has gone down. This acidic environment takes a hit, and that allows for these other bacteria to start expanding. And this is essentially the loss of that normal balance. So then, comparing normal versus pathological findings in BV, we will see that in a healthy vaginal environment, what is dominant is lactobacilli. The pH will be low and acidic, around 3.5 to 4.5. There should be no abnormal discharge or odor. Comparing that to a BV-infected vaginal environment, we will find decreased lactobacilli and increased anaerobes. The pH will have elevated above 4.5. And in symptoms, we should find thin grayish-white discharge with a fishy odor. So then let's look at a typical case example. We have a 30-year-old female presenting with noticeable vaginal odor, thin grayish-white discharge, and mild itching. Her recent history includes douching and new sexual partner. So reports She reports that she's recently, let's say, started douching or douching, meaning cleaning, and she has found a new sexual partner. Both of these are risk factors for BV due to the disruption of normal bacteria. In our physical examination, we do a vaginal exam. We observe a thin grayish discharge with a noticeable fishy odor, very characteristic of BV. Now then, to do a more clinically accurate diagnosis, we again have our clinical presentation with the common symptoms, fishy odor, and grayish discharge, all suggesting BV. Now we have Amsel's criteria to use as our frame when we do our clinical diagnosis. And we want 3 of the following 4 criteria is met. So the first one you will probably recognize now, which is the thin homogeneous discharge, often gray or white in color, and the discharge typically is thin and grayish white in color. Second one, vaginal pH above 4.5. We talked about the normal vaginal acidity standing around 3.5 to 4.5. And that's a normal vaginal flora sustained by the good lactobacilli. Now, for whatever reason, this acidic environment has become less acidic, so we should have a value above 4.5. So this would then indicate a higher than normal pH. Third one is a positive whiff test. So a fishy odor is released when a sample is mixed with potassium hydroxide. The whiff test releases a fishy smell from the sample, again a typical symptom of BV. And finally, we have the discovery of clue cells. So seen under a microscope, clue cells are vaginal cells coated with bacteria, which gives them a granular appearance. And so these clue cells, indicated here and in this image, are cells with bacteria on them. So they show up as grainy or clue-like under a microscope. Finally, then, we can do a gram stain test. So we do a gram stain of vaginal discharge, confirming to us BV by showing a reduction in lactobacilli and an increase in other bacteria. So meeting the Amsel criteria gives us a pretty accurate diagnosis of BV. So then after given the diagnosis, we move to treatment and management of BV. So we have antibiotic therapy, metronidazole, 500 milligram orally, twice daily for 7 days. Or we can go with clindamycin, either as a cream or orally. These are the main treatments, and these help in reducing anaerobic bacteria. So what would be the mechanism of action here? Well, these antibiotics disrupt the DNA of the anaerobic bacteria, killing them and reducing symptoms. If you want to learn more about all the different antibiotics and their different classes, etc., we have dedicated several lectures to that. So moving on, we can also manage it by avoiding triggers, so avoiding douching and reducing the number of sexual partners may help prevent BV recurrences. Skipping this and limiting new sexual partners can help keep the vaginal balance healthy. Furthermore, under research, we have probiotic supplements. So some studies suggest that probiotics, like lactobacillus, may actually help restore normal vaginal flora. However, more research is still needed. So in summary then, BV is a common vaginal infection caused by an imbalance in the normal bacteria, leading to an increase in anaerobic bacteria. Pathophysiology: the decrease in lactobacilli, meaning the good bacteria, and the rise, therefore, in pH allow other anaerobic bacteria to overgrow, causing symptoms. The diagnosis is given based on symptoms, pH levels, and the whiff test, and the discovery of clue cells. These are also mentioned under the AMSEL criteria. Treatment include antibiotics like metronidazole or clindamycin, and of course, avoiding triggers may help prevent recurrences. That's the end of this lecture. Thank you for listening. If you liked our video, please like and subscribe for more videos.